Hello, it's Dr. Feyrer-Melk. I just wanted to let you all know that I've been thinking about you so much during these unprecedented, stressful times. The Optimal Heart Center is open. We're here for you. We've got your back. I've got your heart in our hands. Because of the recent executive order by Governor Ducey, we are making some changes to our practice. The changes are not unique to the Optimal Heart Center, but nationwide. And we will be converting over your regularly scheduled appointments to either a Zoom call or telephone call. Zoom calls work through the computer where I can share your medical record with you. We can see each other, we can talk to each other. It's a highly effective way of communicating medical visits, and we've been doing this for about 10 years. Otherwise, we can always do a telephone call too, so we can keep your program going and keep us productive with your ongoing quest for health. So, all of your currently scheduled appointments remain the same, both with me and with Dr. Steve. We'll just select either the Zoom call or the telephone call, and you're going to get a phone call from the front office explaining this to you before your appointment. So don't worry, this will not be stressful. We're going to keep it seamless and smooth. If you have a lab draw scheduled, come on in. We're fully sanitized here in the office. We're going to be following you around with sanitation measures and keeping your lab appointments intact. As well, ultrasound appointments we're going through just as scheduled. You will have your temperature taken before the ultrasound appointments. The second topic I wanted to bring up to you is testing for the COVID-19 virus. It's a hot topic right now because we don't have enough tests around to test everybody that would like to have this. But Banner Health does have 3 drive-through nasal swab testing sites that you can consider having testing performed if you meet criteria. The main criteria are a fever greater than 100.4 degrees, shortness of breath, or a cough. So if you've got no symptoms, there's no test. But you can call this number and speak with one of their health providers, and they will decide whether or not you need to have the test. If you do, you get in your car, they swab your nose, and we get the results back in 3 to 5 days. A nice option. The third topic I wanted to bring up to you is that of saltwater rinses. The Baldoni method, of which we're doing with you in the program for heart attack and stroke prevention in your artery health, strongly recommends saltwater rinses during this pandemic. What happens is that when you have salt water that enters your oral cavity or your nose, it mixes with your endothelial lining and creates hypochlorous acid. This hypochlorous acid is one of the components in bleach, so it can actually kill viruses. And it's been shown to kill past coronaviruses, although the World Health Organization is not currently advocating the routine use of saline for the COVID-19 virus because there's no double-blind, placebo-controlled trials. Frankly, we don't have time for a randomized, double-blind, placebo-controlled study right now with this pandemic. Saltwater is cheap, it's low risk, and I would have you think about this to A, hopefully prevent the viral load from entering your mouth and your nose, B, reduce the duration of the infection should you get it, or C, reduce spread. This is the simplest recipe you will ever see. 1 teaspoon of regular table salt in a cup of water to gargle, or cup of water to use your Neti Pot. We're going to go ahead and post all of this information onto an email that you'll get in your inbox. I've been staying on top of this coronavirus pandemic for you, and it's unbelievable to me how so many of the lifestyle modifications that they advocate to keep your immune system strong to fight the virus are the exact same things that Dr. Steve and I are talking about you each time that you enter our office at your appointment. Get outdoors. We are completely blessed to have April, this beautiful sunshine and beautiful fresh air and fresh, gorgeous weather to go ahead and do your physical activity that'll make Dr. Steve and I happier than anything. Shoot for 30 minutes a day if you can. You should have the time if you're staying home. Also, we want you to take care of your teeth and your gums meticulously now because, as you know, dental offices are closed until maybe mid-May, except for emergencies. So heighten up your dental regimen. We want you to drink half of your body weight in ounces of water per day. Stay well hydrated. Make sure you're protecting your sleep at least 7 to 8 hours per night. Super important. Make sure you're taking your vitamin C, 1,000 milligrams daily. And if you start to feel sick, go ahead and double it. You know you're getting too much vitamin C if you start to have loose stools. Also pushing zinc. There's some evidence that zinc has treated past viral plagues. So we want you to go ahead and push your zinc up to 50 milligrams per day. The benefits of meditation, mindfulness, spending time with family and friends. It's wonderful that we do have some extra time to indulge in those activities with our loved ones. And no matter what, be kind to yourself and be kind to others. Pay it forward.